Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. David Levinger. He's Associate Chief Medical Officer and Chief Informatics Officer at Carle Health, and Dr. Ed Lee, Chief Medical Officer at Nabla. Welcome, guys.
Thanks
Thanks,
for having us,
John.
John.
Good to be here.
Yeah, excited for this discussion, an ongoing discussion of the hottest thing in healthcare since they gave $36 billion in stimulus money, ambient clinical voice. But before we dive in there, let's do some intros. David, do you want to start? Tell us a little bit about yourself and Carle Health.
Sure. My name's David Levinger. I'm a general internist, was a former hospitalist for many years. I've been interested in healthcare IT since I was a medical student and saw lots of potential. Carle Health is a large, well, 8 hospital system in central Illinois. We have affiliations with a number of our smaller systems in our neighborhood. We work with the University of Illinois on the Carle Illinois College of Medicine, which is an engineering-based medical school, and really have a mission to, improve the health of our communities. And this is healthcare IT is a really promising area to do some good.
It is. I'm sure you've seen a big evolution as we're going to talk about some of that today. Ed, tell us about yourself and Nabla.
Yeah, no, thanks, John. My name is Ed Lee. I'm also an internal medicine physician. I've been the chief medical officer for Nabla for several months now. Nabla is the producer of a leading ambient AI solution that's been deployed to over 30,000 clinicians across the United States, saving time, reducing administrative burden, improving clinician burnout, and bringing back joy to clinical care.
That's awesome. 30,000 clinicians. Wow. That's the acceleration and adoption of this has been amazing. And maybe we start there, David. What's been your approach to ambient AI assistance, and how did you end up choosing to roll out Nabla? Kind of what set it apart?
So we have tried a number of ambient listening solutions, and in fact, I remember when I first heard about this. Right, you turn on this device that listens to your conversation, and it spits out a note, and it saves you all this time and effort. And I think that has really been true and been our experience with Nabla. They're ambient AI, though they're not all created equal. Um, I think one of the great things about Nabla is it's been so easy to use. When we were looking at this, my partner, my administrative partner said, "Hey, we can go to their website and try it out." And not only was it great, it had features that other ambient solutions didn't have. One of the best things was I did a role play with with a nurse who is our VP for Epic Systems. She came in with a cough and a URI and said that she smoked a lot, which she doesn't in real life. And so when we were talking about it, I told her what to do. And Nabla added a don't forget to quit smoking in the patient instructions, which I hadn't mentioned because she doesn't really smoke. Um,
That's
but it was
interesting.
just a nice, complete tool. I find it works really pretty much as advertised, which is great in my clinical encounters, and I truly enjoy using it.
Interesting. And anything you'd add? You work with a lot of healthcare organizations now, and how they're selecting these ambient solutions. Are there other things maybe that you'd also highlight that kind of sets Nabla apart in the industry?
Yeah, no, absolutely. And first and foremost, though, before I get into that, I just want to mention that we're thrilled to be partnering with Carle Health. And, through this process here, we've gotten to know the organization and have been thoroughly impressed with their leading healthcare system, driven by deep philanthropic spirit and really known for their innovative approach to integrated care. And so we're deeply honored by their choice with helping us be partners in their mission to help alleviate clinician burnout and enabling their dedicated team to focus on what truly matters, which is providing the best care possible for their patients and their health plan members. In terms of Nabla and our feature set, we pride ourselves on being one of the most customizable ambient solutions out there, where a physician, any clinician can customize their note to the way that they like to write their note. We know that no two clinicians, even the same specialty, write their note in the same way. And so we want to mimic as best possible how they would want to write their note. So that's one of the features there. I mean, the ability to do what we call magic edit, which is to inject some additional instructions into how they want their note to be processed, allows further customization. So that's really, I think, one of the top features that our users are really enjoying.
Yeah, I love the magic edit. I also love the patient summary. I think that's a fascinating. I think that's a fascinating look into the future of it. But we'll get there in a second. But David, talk to us about it. As I understand it, you did a 4-week long pilot with 20 providers across a number of specialties, and now you're looking to roll it out more broadly. Can you talk more about the pilot process and some of the results from the pilot? How did you measure the success, or what were some of the user comments from the pilot?
Yeah. So I wouldn't say that we did like a publication grade study of what users' experience was. But the sense of what people said was uniformly positive. We had one subspecialist who we all kind of internally referred to or compared to Mikey from the Life cereal commercial. He doesn't like
If
anything.
Mikey likes it, then everyone likes
and
it.
He really did. And he was very critical of a prior solution that we had tried. It just never worked for him. And I think that, and in his defense, he's not a Luddite. He wants it to work. He wants it to be easy. He doesn't really care about the internal workings. And he was a pretty good, fair broker on this. And when he liked it, I knew we had something that would work. Nabla has been really like ready out of the box, which is having dealt with a lot of software vendors, was a very pleasant surprise.
That's interesting. And now you've decided to roll it out to, I think you have about 1,500 Carle Health providers. Talk about that decision and, from the initial pilot to now rolling it out site-wide.
Right. So the way we piloted it was with a separate, a standalone app. So you would record the visit. You go back to your desktop, you open up your browser, and it would be there, but you'd copy it from the browser and paste it into your note. And what's interesting is, that workflow is a little clunky. Nobody complained about that because the value was so good. But what we've done is we've integrated it with Epic so that, you could do 5 or 8 or 10 or however many notes or patient sessions and come back, and it's in your Epic and it's in the right chart. The other thing that is there's like a lot of like little things that are just super nice, right? Sometimes Nabla can't tell the gender of the person you're talking to. Well, you can change the pronouns. Which I prefer to sound that way. I know everybody has a preferred way to sound, but it's very thoughtful about how users interact with the tool. So we're going to a larger pilot, not pilot. We're rolling it out. Here it is. Let's use it. And we expect big uptake because, there was good uptake, really good uptake in the pilot group, and people are literally banging on the doors to get in. We can't work fast enough to get it integrated and ready to go. So we're very, very excited about that.
That's awesome. Reminds me of the doctor who says, "Wait, are you going to take this away from me?" I think that was our last video, or
Right.
during the pilot, they're like, they've had other experiences, no doubt. They did get it
Right.
taken away.
Right.
So I think it's interesting how the right technology, the right solution, doctors will adopt on their own. You don't have to push it down their throats. So, which is kind of what we did with EHR. But anyway, that's a little side note. Dr. Lee, I'm sure that you have some strong feelings about the integration with EHR. You've been working hard at Nabla doing these EHR integrations, specifically, with Carle Health. You're rolling it out, the Epic integration, and the rollout to the 1500, as David said, is to the all through Epic. Talk to us more about that EHR integration. What are you seeing? How does that work, and how's that going?
Well, so we know that EHR integration is either at or near the top of the lists of what health systems need. And that's why we've dedicated significant energy towards integrating Nabla into Epic. Clinicians at Carle Health will use the integrated version of Nabla within Epic on their desktop or their mobile phone. Nabla will automatically pull relevant patient data from the patient's chart to provide additional context about the patient. So the details of the note can be better informed. The note generated by Nabla will be exported with a single click directly into Epic, without the need for the manual copy and paste. And that's something that I'm truly sensitive to, the additional clicks that clinicians have to do. With the introduction of the EHR, there were so many clicks, and having this integration of Nabla into the EHR alleviates a lot of that there. And then, the other thing is that as part of the Epic integration, Nabla will also suggest updates to the patient's problem list, such as if a new diagnosis is made during the visit. So it's not just the note getting into Epic, but it's all the other things that we'd want to see in terms of integration between outside product into the existing EHR system.
It feels like EHR vendors are finally coming around to needing to do this as well. Is that what you're seeing as well, Ed? That they're opening up the kimono, if you will, to allow for these types of deep integrations all the way to the problem list.
Yeah, no, I think so, because I think there's a realization from the HR vendors out there that they're really good at doing a lot of things, but they're not necessarily expert at doing some of the other things. And that's where I think, Nabla comes in, where, we are very good at, doing that ambient scribe technology. We're really good at understanding and hearing what happens during the conversation between a patient and a clinician. And there are many things in which can be extracted from that interaction, including the note, but also including problem lists. And in the future, we'll be able to do things like, penned orders, also suggest other updates to the EHR, like social history, family history, other medical history. And so all those things, I think, are ripe for EHR integration. And I think that, as you mentioned, EHR vendors out there really understand that there's value in allowing these APIs to connect with outside products so that the users of the EHR system can benefit from all aspects here.
David, what would you add as far as the importance of this EHR integration? I find it fascinating. You said that the doctors were okay copying and pasting. Yeah, I'm not sure that lasts long term, right? Pilot's one
Right.
thing, right? But Mikey liked it, but Sally's going to complain about why isn't this integrated, right? So talk to us about
Sure.
what you see there and what you're seeing in the integration.
So, I mean, as you mentioned, right, copy paste is not a long-term solution. I think that's just an indication, though, of how useful the tool is. But it is it is very much a moving target. And the heart of Nabla is the ambient listening, but all the other things make it better and more useful. So I feel like AI in general has a lot of potential in healthcare, and Nabla is just one of the better expressions of that. But I also think that, like, understanding the clinician's workflow and making sure that you fit into it is what's going to be essential going forward. Chat GPT and all of those other technologies do some really cool things, but cool things don't get you very far in healthcare if it's not really part of your workflow and, just helping you get done quicker. And I think, and I want to also say that one of the big values to Nabla, at least for me, is not just that it saves me time, but it hears everything that goes on. And sometimes, if I've done several interactions with a patient and now I've got the notes, it's got more detail than I remember. And I feel like I'm doing a better job at understanding and hearing my patients when I use it. So integration is key, but it's just something that's going to continue to get better.
Yeah. Well, what a fascinating way to look at it, that your patients are going to benefit from a more detailed note, and the care you're going to be able to provide. I think that's an amazing perspective to look at, that this is a patient-centric solution, because now the doctors focus on the patient, including in the quality of the documentation that's created. That's a beautiful way to say it. Ed, anything you'd add as far as keys to working with health systems such as Carle Health? Or, I think, he highlighted the key to the importance of workflow and making sure that that works for them. Any other things you're seeing as you roll this out to more health systems?
Well, I mean, the way I see it is that Nabla succeeds only when our partners succeed. And so there's really nothing more gratifying than seeing our tools lead to time savings, burnout reduction, and happy clinicians enjoying patient care again. So we understand what's at stake. And so with each rollout, we deploy a team that's dedicated to implementation success. So this includes people focused on clinician training and onboarding to ensure that clinicians are comfortable and proficient with using the technology in their day-to-day practice. We also take the time to learn about any organizational specific details so that we can ensure a fit, as been discussed already, a fit into the clinician's existing workflows. And we're willing to understand and we're able to customize, develop features when necessary too. So, I think what we do is we bring a wealth of knowledge and experience and can share our best practices that we've developed through our other large-scale implementations with other health systems.
That's awesome. So, David, what kind of advice would you give to other healthcare leaders looking to implement ambient AI solutions that are evaluating it? What should they be looking for? What advice would you give them?
Yeah, great question. I think that you've got to really understand your clinician's workflow and how the tools fit in. I mean, I think ambient listening is one of the best use cases for AI, but there are plenty of others. I also feel like finding a vendor that you can work with. We've had other vendors who say, this is our product, and we think it's great, but this is our product. Whereas with Nabla, every time I give them feedback about a note that, maybe it could have been like this or like that, they show me something under the hood that I wasn't aware of that solves the problem, or they're actually excited about it and they want to work on a solution. I've been really happy with how Nabla is really focused on who we are, what we do, what feedback we give, and has been really responsive. And that's not so common in vendors. And those are important things that when you're making the choice about who to partner with.
Yeah. Ed, as we wrap up here, talk to us, where's all ambient AI assistant technology headed? I mean, obviously, you have a lot of demand, you're rolling out a lot of it. Where do you see it kind of going next? And what's next for the collaboration with Carle Health?
Well, so there is just so much that can be done through Ambient. Like I mentioned, there's so much information that's transmitted between the patient and the physician during conversation. And so any of those components that can be picked up through that conversation, I think is where we'd like to go in the future. And not only, like I sort of mentioned, additional updates to different parts of the chart there, but also assistance with coding, HCCs, CPT codes, also things around, maybe in the future around clinical decision support. I think all that is, potential areas that we can continue to work on. Specifically with Carle, I think that we're just at the start of a long, fruitful relationship here. Looking forward to rolling out Nabla to additional groups, the emergency department, hospitalists, subspecialists, nurses, both bedside nurses and phone triage nurses, therapy services like physical therapy, speech therapy, occupational therapy, and behavioral health, area that I think we're quite strong in. And, I truly believe that the more that we can get additional clinicians on board, the better off Carle Health will be in from a clerical burnout perspective.
So much opportunity, as you both described, and I think you're right. I think we're headed to more automated coding, clinical decision support. We're just at the start of this journey of what's going to be possible with all the data that's being collected by the Ambient AI assistant. So, David, Ed, I appreciate you taking time to talk about your experience and implementing this exciting technology and how your organization is adopting it. So thank you so much for taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, guys.
Thank
Thank
you.
you.